Microneedling, Derma Pen, Derma Roller. I'm sure you've all heard of that. The question is really, who should have a microneedling treatment? Now, firstly, microneedling, the actual name of the treatment is called Fractional Collagen Induction Therapy. What that means in layman's term is I'm going to use a needle, I'm going to make a tiny little hole in the skin, and as I make that pinprick little hole in the skin immediately is going to call upon its immune system, and it's going to literally isolate that area. But while we're doing that, we actually have the regeneration of the skin, because we call upon our fibroblast, which is our cell that makes the collagen and the elastin and like the hyaluronic acid, which literally is the scaffolding of your skin. So it is a wonderful treatment for people that battle with aging, even for pigmentation. For pigmentation, we work quite shallow in the skin, particularly if it is more the epidermal pigmentation. So we're working on a 0.3, maximum 0.5 millimeter into the skin. Whereas when we're working more on the aging skin, obviously we're going to go deeper in the skin. And often we start at least on a 1 millimeter, depending on the area of the skin, of course, as well. So what's the big difference between the Derma Roller and the Derma Pen? Now, firstly, there's many different brands of Derma Rollers and Derma Pens, and there's actually an Australian brand that called their pen the Derma Pen. But don't be mistaken, any type of electrical pen with needles is known as a dermal pen, okay? So firstly, let's talk about the roller. The roller was the first, kind of method used, and it actually came from one of the South African plastic surgeons, Dr. Des Fernandez. And what he did is, while he was doing mesotherapy, which is a technique that doctors use where they take a syringe with a needle and they inject a cocktail of vitamins into the skin, but really more superficially under the skin itself. And through that, he saw that there was great collagen induction. So he thought, what if I make a stamp? So something with loads of little needles. And he made the stamp, and then a German doctor came around, and he then made the stamp into a roller. And so we had the Derma Roller. The problem with the roller is that you had to choose the length of your needle, and they normally came in a 0.25 millimeter, a 0.5 millimeter, and a 1 millimeter. And then for the doctors, there would be a 2 or a 3 millimeter that they would use. The challenge that we have, though, is that the skin is much thinner around the eye area, it's much thinner on the forehead, much thinner on the nose versus the cheeks, versus the chin, and versus underneath the neck and the neck itself. So the challenge was, what length needle must I choose? Because am I going to work shallow? Maybe it's perfect for the eye area and the forehead and the nose, but then it's just too shallow for the cheeks, and I'm really going to get that induction that I want to. So then came the electric pen, which we love. So it's a needle that a head of needles. It's normally about 9 needles. Some of them are 16, some up to 22, but there's different ones. Now, it doesn't have to have a lot of needles. 9 needles is absolutely fine. And then we actually open up that needle in front of you, and we then put it into our pen, which obviously is sterilized between every client. We've got different protective films and stuff that we put over it. And then basically what we do is we start the needling process, but we can adjust the depth of the needle, and that's what we love about the electric pen. So we can go nice and shallow on the forehead, the nose, the eyes, and then we can actually put it deeper to work on the cheeks, underneath the chin, and obviously also the neck, depending on the problem that we are dealing with. On an aged skin, we often want to work a little bit deeper in the skin because we want to really work against those wrinkle formation and try and plump out the skin. Whereas in a hyperpigmented skin, as I mentioned, we work more on a shallow level, so we don't go very deep into the skin. So your professional will decide what it is that we are treating. I also absolutely love the microneedling for a more sensitive skin that's often red all the time, even a rosacea sufferer. But of course, we're not going to work very deep in there. I also love to use a really good blend of active serums, and I change it all the time. Every time a client comes for a microneedling treatment with my Derma Pen, they come normally every 4 weeks, and I change up the serum. Even if it is for pigmentation, I normally have 2 to 3 different hyperpigmentation serums, in my cubicle. So I prefer that you go to a professional to have it done, because the sterilization is the way that it should. The needle is thrown away after every visit, so you don't keep your same needle. We open a new one in front of you, we throw it away afterwards. So every time you come, it's a new needle. The needles don't get blunt, they won't tear the skin. And then of course needling in a really nice strong professional serum with a lot of anti-inflammatory ingredients and products that we use afterwards. And then also I love to give a product after my client has had the microneedling with me, and they use that cream for 2 days afterwards, which has got beautiful copper peptides in to speed up the healing of the skin. Now, for the first 5 days after you've had a Derma Pen treatment, your skin will look a little bit dull and a bit lifeless. And the reason for that is that the dead skin cells in the epidermis is actually being moved up so you can visually see it more. And there's obviously a buildup of those cells because we want to get them to fall off, because we're making beautiful new cells in the basal layer of the epidermis, which is the deeper layer of the epidermis. Then, so you can use a light exfoliation, depending, speak to your professional about that, by the way. And then from week 2 to week number 4, we have beautiful dermal restructuring. That's where we're working on the true living skin of or the true living part of the skin. And that's then where we are rebuilding that scaffolding of your skin. So by week 4, before you have your next treatment, your skin looks fantastic. Then you have your next treatment, and then you go through 5 days of looking dull, and then from week 2 to week 4, the skin gets better and better. After normally a course of 4 treatments, you can expect your skin to be plumper, you can expect redness to be gone, you can expect a more hydrated skin. And another great thing about the microneedling treatment is that it also enhances any cell-to-cell communication. We kind of just speed up all the processes in the skin, everything that's got a little bit lazy as we're getting older. So it is truly a phenomenal skin treatment. It can be done on any skin really. Even in America, it's very popular for dermatologists to do it on an open or inflamed acne skin. So lots of pustular type of lesions, because as they pierce the skin, we're getting oxygen into that follicle or that pore that kills the propionibacterium, causing the breakout. But we're also building your scaffolding. So chances of you actually getting an acne scar is far less, which is exactly what we want to do. So speak to your professional about the best treatment for you. It is a great treatment. I love microneedling treatments. It's a quick and easy treatment. It's normally 45 minutes. There's a numbing cream that's applied on your skin beforehand. And then obviously your doctor can work much deeper in the skin than what your professional therapist would be. So there's even sometimes that we combine a chemical peel with a microneedling, specifically for the hyperpigmented skins, or even a very aged, lackluster skin, maybe a smoker's skin, or a lot of damage or sun damage on that skin. Great treatment to have. Send me any of your questions that you have about the treatment. Don't be scared. I'm petrified of needles, so you won't find me going to have a drip or going for blood tests. If I absolutely have to, I will. But the microneedling is so easy, and it's really a great treatment to have. Your skin, you just love the results. And the downtime afterwards is maybe 2 days of redness. So you look like you've got a sunburn, you feel like you've got a sunburn, but your professional can give you great professional aesthetic foundations to cover up the skin, speed up the healing of the skin. You can ice your skin the night of the treatment, the next, until the redness goes away. So there's so many great tools we have to also help the skin to heal afterwards, that it is a wonderful treatment with very, very little downtime in comparison to how deep we work and the effect that you get.